What would normally be a busy medical patient unit here at Nigeria's main hospital is now nearly empty. That's because resident doctors around the country have gone on strike indefinitely, calling for better work conditions and pay.
But when you're in a situation where you don't have funding for the training program, your salaries are paid in percentages, your hospitals are poorly equipped, you have few of your trainers, so you wouldn't blame the poor training program. Even as you're making noise now, our training program doesn't have a budget line.
The World Health Organization currently reports 1 doctor for every 600,000 people in Nigeria. However, the government is now calling for consultants and health workers to double their efforts in treating patients in order to fill the gaps left by the doctors' strike, a move that has angered many in an already strained health sector. Mediating talks between both parties is Professor Mike Ogirima, who heads Nigeria's Medical Association, and says both parties continue to negotiate a settlement.
It is regrettable. The government is at fault. But my younger colleagues too, I blame them for taking a rush decision.
Experts argue the government will need to pay closer attention to the demands of the healthcare professionals in order for the matter to be resolved and see doctors returning to work.
In terms of manpower, we are far, far below. We have taken care of 170 million people of Nigeria, about 40,000 doctors, far, far below the WHO standard. The working environment is not all that good. The doctors are still left with obsolete equipment.
The government says it's doing everything it can to meet the needs of the resident doctors and claims the doctors would not be worse off under their new contracts. Patients in hospitals like this across the country have been forced to rely on consultants and health workers while negotiations continue. And many of these hospitals are operating with severely reduced services, with all parties hoping a resolution will be reached soon. Sophia Adengo for CGTN, Abuja, Nigeria.